This is one of its kind event which is happening in Namma Bengaluru, organized by NewsFirst, that is Path to Parenthood. And right now I have here with me today Dr. Uma Nambiar, the CEO of Indian Institute of Science School of Medical Foundation. Hello, ma'am. And I think you just spoke wonderfully in the summit there inside. And one question is that usually when people say IVF or surrogacy, they always think about the higher cost. So they say, though, this is not affordable, we can't, opt for it. So how can a medical field adopt steps so that they can make this treatment cost efficient and, of course, not a burden on a common man?
Well, thank you for asking that question. It is very pertinent. One of the reasons the cost of IVF is so high is because uh, it is not covered by insurance, and patients have multiple cycles, and the treatment is very prolonged. So, this really leads to high cost. The second reason for high cost is when the patients undergo an infertility or assisted reproductive therapy, they end up being high risk pregnancies for various reasons, and multiple pregnancies, like they have twins or three kids and all that. And they are also in an older age group, because by the time they decide that they need to undergo an assisted reproduction, they have spent a lot of time trying natural ways and many other techniques which have all failed. So all this lead to a very high cost. So when you see, one of the first reasons is that failure of multiple cycles. Why does this happen? Because right now we don't have mechanisms, or it is very rudimentary as to how we select the embryo that can be transplanted. Now, with advancing science and advancing technology, it is possible to select what is the best embryo for that particular couple. Not only you can select the best embryo that is suitable, you can also decide based on certain technologies and tests that are available as to what is the right time during that fertilization that the embryo is best suited for transplantation. So reduces the chances of rejection in the cycle, increases the chances of success in the first second cycle, so that the number of cycles, like 3 4, I know people who have taken 3 4 cycles and not succeeded. So this will reduce the cost. It will also, the other thing is, they have a lot of psychological stress, because not being able to become a parent, social stigma, parents, in-laws. Dusra, you are a career woman, slightly older, then the pressure at work, all this combines. So large part of the cost also goes in, stress management. So if we can do telehealth and we can do remote counseling, so they can prevent, you can actually prevent the stress. You can advise them remotely, so you can preserve the privacy and confidentiality of the patient, and therefore reduce the cost and have better chances of success for the fertilization attempt, because increased stress reduces the chances of success of therapy. So the cycle failure can also be reduced like this. Another very big factor which is there in India, at least, is supposing patient from a remote area has to come to a good fertility care center and see a specialist. So what happens? They will go to different gynecologists, different medical specialists, anybody that they know, and take different kinds of treatment. Multiple investigations will be done, and every doctor that they go to, they will repeat the investigations. They won't say ki purana theek hai. They will repeat the investigation. So it will be lots of investigations, which by the time they reach the correct specialist, they would have wasted money in multiple investigations, seeing multiple doctors. Then they'll say, okay, go to Bangalore, go to Bombay. They'll come to the town. There are a lot of touts. They'll say, I'll take you to the right doctor, I'll take you to the right specialist. Then they'll roam around 10 different places, 20, 30 days, 2 months gone. And they would have wasted 20-30% of the money that is actually required for the total cost. This cost can be avoided. You do a telemedicine consult, you contact a doctor in the city, contact the right hospital, show the investigation, send them by mail, get them to evaluate, do the tests that you can do locally, so that you don't have to come to town for certain tests which you can do everywhere. Like CT scan karna or some ovulation study karna, you can go to the right place. And the day you have to come to the hospital in the city, get an appointment. So you're not roaming around Bangalore looking for a doctor. So this particular reduction itself is a big, saving for the patient. So these are multiple things that you can do to save the cost. And of course, if you have the right data, and today the major thing is you should be able to get all the data on the patient. You can use genomics, you can use artificial intelligence on the patient's data, you can do gene editing, you can do all of this, and this is where technology will help to improve the success, to personalize the treatment of fertility. Yani ki if you have one treatment, give it to all. Some it may work, some it will not work. But if I personalize the treatment for a particular patient, it will work. The chances of success are high.
It's not just one mode of treatment to cure infertility, but there are multiple treatments which the couple can opt for. And of course, if they plan it in a proper way, that will also affect in the cost reduction of the entire treatment, is what Dr. Uma Nambiar just said.